Uhuru Kenyatta has attributed the significant progress in the war against malaria in Africa to a 4-point program implemented by the African Leaders Malaria Alliance, ALMA. The head of state who spoke in Addis Ababa, Ethiopia, where he presented last year's ALMA Malaria Progress Report, further lauded African countries for embracing the use of digital tools to strengthen evidence-based accountability and action in the fight against the disease. Purity Museo reports.
During the ongoing 35th Ordinary Session of the Assembly of Heads of State and Government of the African Union in Addis Ababa, Ethiopia, Sunday, President Uhuru Kenyatta said that Africa had made significant progress in the war against malaria in the last 2 years.
When I became the chair of ALMA, I established an ambitious 4-point legacy agenda, and I am pleased with the progress that we have made so far.
The head of state who spoke when he presented last year's ALMA Malaria Progress Report further said that isolated digitization and accountability and action scorecards, one of his 4-point agenda against malaria, was an important tool in the campaign against the disease.
Our countries are implementing national scorecard tools, and this includes 40 scorecards for malaria, 29 for reproductive maternal newborn, adolescent and children health, 8 for neglected tropical disease, and 3 for nutrition, and 5 community scorecards.
President Kenyatta pointed out that in 2021, Kenya launched the ALMA Scorecard Hub to enable countries to share national health outcomes and best practices. To boost access to life-saving anti-malaria commodities, the president said countries are deploying mosquito nets and insecticides to address the threat of insecticide resistance.
To eliminate malaria by 2030 as per the AU agenda, we as a continent must scale up our collective efforts. I am glad to report that our countries have heeded to this call. And despite the pandemic of COVID-19, countries have provided strong leadership and did take concerted action to ensure that universal mosquito nets, indoor residual spraying, and seasonal malaria chemoprevention campaigns, which were implemented as planned.
While rallying African governments to invest more in the fight against malaria for the continent to meet its target of eliminating the disease by the year 2030, the president applauded the Global Fund and the U.S. President's Malaria Initiative for their continued support.
Available data shows that African countries account for 96% of global malaria cases, as well as 98% of global malaria deaths. So we are not on track to eliminate malaria by 2030 unless far-reaching strategies are adopted and executed to the letter.